Everyone, hope you're doing well. This is unscheduled. Don't know if my sound's coming through. It looks like it is. Um, I'm in the airport, getting ready to head to the UK. I'm going to be going to London, um, straight to London from Vancouver. I'll be hitting the train from Paddington Station, going down to, well, I'm not going to tell you where I'm going, but my first stop is only in London to get a connecting uh, train to a clinic. And so I'm sitting here at the airport getting my travel nutrition, and thought I would take this time before I'm boarding. I got another 20 minutes before I got to take off, before I got to go to the gate, and thought I'd answer some questions. I haven't been live on my own in quite a while, but I am going to be live at least a couple times on this trip. I'll be gone for a week. And hey, Ken, how you doing, buddy? Thanks for joining me. But yeah, I want to take this opportunity to just sit here with my laptop and answer some questions if you guys got any. If you don't, that's fine. You're just sitting here having a beer, had a lovely chicken curry pre-boarding snack. And I got to tell you, it's been several years since I've done this clinical visit tour or a clinical visit tour. And it's nice to be able to come in the evening. And I'm noticing that it's really nice to get the benefits of a later flight. So it's a red eye, and I was at the front gate, checked in through security in less than 30 minutes at my gate. So that was nice. Ken, do you have any questions? Want anything you want me to answer for you? Like I don't know how long it's going to last. I'm just sitting here kind of bored, so I thought I'd fire up the live stream. But yeah, so what I'm excited about is, like I said earlier, this is the first time that I've been on this type of tour in several years. Last time I traveled for work specifically, I was at the World FUE Institute meeting, I think, was it 3 or maybe 4 years ago in Istanbul at Dr. Koray Erdogan's clinic, ASMED, which is a phenomenal clinic. I love going there. And I will be going back again in maybe a month, maybe 2 months. I haven't finalized the plans on that, but it's time to hit the road again. And yeah, so I'm going to be hitting some clinics. This week, I'll be in the UK. And then maybe this time next month, I'll be in Turkey. I'm not quite sure, but that's probably the next stop or the next trip. And then I'll be hitting probably the US. Several, 2 or 3 trips in the US because there's so many clinics I work with there. And then back to Europe. Let's see here. Hey Vince, how you doing, buddy? Last week during a phone call, you mentioned it was risky for good reasons you described to do a beard to scalp transplant. Has your opinion changed after the video you posted on Instagram the other day? No. With the stellar results, or is it very individual patient determined by the doctor? There is, I mean, look, it all comes down to the doctor, but no doctor can guarantee an outcome. And if they are, I mean, anyone that's been following my channel, my website, you know that I'm not big on guarantees. What's going on with my hair? There you go. I'm not big on guarantees because you can't guarantee literally any surgery. And when you venture outside of the scalp area, your challenges increase. Your hair is very robust, but it's not so much the growth that I wish people to be aware of, or but it's more the fear that it will grow just fine because it's beard hair. And contrary to what many people say, it's very rare that it actually takes on the characteristics of scalp hair once it's been transplanted to the scalp. So it takes a doctor to understand the characteristics of the hair that they're working with, both donor from the beard and the recipient, blending it into the existing hair. And even the best doctors, insert doctor name here, don't get it right every time. It's just not possible. And that's the case with um, all doctors at any clinic. No one's perfect. If any doctor has been performing surgery long enough to be recognized as good at being good at what they do, they have some patients that are unhappy. They don't think that they're so good. So um, I hope that answers your question. No, it hasn't changed my mind. It's very risky, very being relative, but it's it's risky to consider that as a consistent adjunct to using scalp hair. Hope that answered your question. Um, let's see. Anyone else? A lot of people watching. That's fine. I wasn't expecting a lot of people. No worries, Vince. You're very welcome. Okay. We've only been on for 6.5 minutes. That's not bad. So I'll be signing off here probably about 10 minutes. There's my flight. Yeah, probably just trying to think here. Yeah, maybe 10 minutes, maybe a little bit longer. But anyone else watching in the chat or not in the chat, you can ask me some questions, and I'm happy to help out. I'm hoping to do this more often in official capacity to get the main event going. I didn't have the intro for today's show because I don't have the video clip with me to make it slick and professional looking. But yeah, I just was thinking about you guys with your questions and concerns, and I've not been live streaming in quite a while to answer questions directly to you guys. So I thought I'd pop on and say hi. So, like I said, don't know how much longer I'll be here. If I don't get more questions, it's fine. I got other things I can do. I'm downloading some movies on Netflix. Stripboard has entered the chat. Guy B, you're the stripboard, or you call me the stripboard? I'm not sure. I'm downloading some movies on Netflix on my phone. There we go. Hey, Nico, what's up, buddy? What's a standard test sample size for a BHT procedure? Hope that makes sense, and hope all is well, Joe. All is well, Nico. Thanks for the question and the well wishes. What's a standard test sample size? There is no standard because body hair transplants aren't standard. It's like it's a fair question. It really is. And I'm not chuckling at the question. I chuckle at the idea of there being standards because there are very few standards in this industry. Um, you know, if someone's going to do a test patch, it might be 100 grafts. It might be 50 grafts. It all depends on how aggressive they are, how confident they are with what they do. Um, I would say if you're going to get some sort of test patch, I would say don't go over 100 grafts. That's a healthy sample to give you an idea of what's going on. But the other problem with that is let's assume you get 100 grafts and you get, say, 95% growth. 95 out of those 100 grafts grow and grow well. That doesn't necessarily translate to if you get 5,000 body hair grafts. It doesn't necessarily mean you get 95% success with that procedure as well, because it's so many variables with that across the board, especially body hair. I think that body hair in general should be done in and of itself in small sessions. 1,000 grafts here, 1,000 grafts there, and see how it works out every time before you move forward. Because if you have a lot of body hair, then you're not really wasting a whole lot. And I don't know. I think that's the best approach. So hope that helps. On call 21. What's up, buddy? Hey, Joe. Safe travels. Thank you very much. Appreciate it. Um, Vince, back in my mid scalp needs more density. Didn't want to waste my fourth final FUT on it. Wanted to save it to the crown and use beard or back of mid scalp. Yeah, that's fine. I mean, um, just just be careful with it. Um, maybe scalp hair would be best. Maybe FUE, like give FUE a shot for your scalp either as well. So that could be a good alternative. Uh, let's see. I can always just keep painting the back of my head though. I've always had that option. Absolutely, yeah. There's nothing wrong with that. I mean, Spencer's been doing it since the Civil War, so um, if you can do that and be fine with it, then that's the best option for sure. Hey, you got 15 now. That's cool. Thank you. Sky B, final FET, the fourth pass. You're just getting started, Vince. Yeah, exactly. What do you guys think of my haircut? This style, I had someone asking me how long does it take me to style my hair, and honestly, guys, it takes like less than 5 minutes, like 3 minutes maybe. I'm talking like once I get out of the shower, I'll spray a little hairspray in it, maybe sometimes just to give it a little bit of body when it's still wet. I'll tussle it up, let it air dry for 2 minutes, and then I'll blow dry it, mess it up while I'm blow drying it, and it comes out kind of messy. And I just kind of use my fingers to put it in place, spray the shit out of it, and that's it. So, um, let's see. Hairless Great Joe, you look younger each year. Sky B, you're a brilliant man. Thank you. Let's see on call. Do you have product in your hair, Joe? Nope, no product. A little bit of hairspray, and that's about it. A.L. Herbert. Hey, Joe, will you ever be working with any docs in the DC area other than Dr. Lindsay? Didn't feel like he was a match for me. I've never worked with Dr. Lindsay, just to make sure you understand that. The way you worded that, wasn't sure. I know Dr. Lindsay. I mean, I've talked to him a couple of times. I don't know him, but we've spoken. Um, it depends on who is in the area, who applies, and then who winds up qualifying based on my standards. So I can't say yes, I can't say no because I don't know who's there. No one's contacted me recently out of DC. So if you know of anyone that is healthy with their skill set, tell them to reach out. The 90s girl, hey, I found your channel a month ago. I've since booked in for FET to fix my hairline. That 90s girl. I hope you picked a good one. And I hope my existence here on the interwebs has helped you in some way. So good luck with that. Let's see. 21 people in the room. Awesome. Thanks everyone for joining this impromptu live stream. Beer in a live stream. Pre-boarding at the airport. Getting ready to head to London and then catch a train to parts unknown, at least to you guys. Joe, what are your thoughts on Dr. Ruck in Brisbane? Never been a fan of Aussie surgeons, as you know. On call, I've seen him. Um, I don't want to say too much, like because I've not looked too much at his work, so I don't think it's fair if I make comments without diving deeper into it. I've done this before, and then I've gotten calls from doctors, I've gotten calls or messages from patients. I need to be careful with that. I've seen his work, but not much, and not enough to make a comment on. So if you got some examples you want me to look at, you know how to get in touch with me, fire them off to me. I'd be happy to look at them. I did see a fantastic result from Dr. Beyrul. Beyrul? I forgot how to pronounce his name. Bevan Bevan Boy Rule. Yeah, your doctor, your minoxidil doctor on call. Uh, Fantastic outcome. Just I was like, wow, okay, because he doesn't post very much for his surgical work, and it looks fantastic. Really good stuff. Let's see. Kendall Hughes, greetings. My dad is scheduled for a 50,000 hair transplant, $50,000 hair transplant at Alvia Armani Beverly Hills. Do you think he's wasting his money and should instead just get a 2,000? No, no, don't just get a $2,000 dollar hair transplant out of Turkey. Um, Alvia Armani is really good. I've been diving deeper into um, the doctors there. You know, ever since Dr. Bobak passed away, that was a big blow to the industry. He was really good. But what's interesting about Al Birmani is they're the only clinic I know of that has a mandatory 2-year fellowship for their new doctors before they can be set loose with their own patients. And uh, I did a recent video for their Salt Lake City clinic, and there that place is really good. The doctor there, Doctor, what's his name? Yeah, I forgot his name. Uh, Go. Hold on a second. Mm, Craig Barton. Yeah, that's who it is. Craig Barton. I'm terrible with names. He's a workhorse. He does all the extractions himself. He does up to 4,000 grafts in a day, which I think is, and he does it consistently. He does more grafts in a surgery than any other U.S. doctor, and he does it himself. And he does some of the placement too, which is really really solid. Good for him, and he does some really phenomenal work. So you know, is it worth it? I can't answer that. Is it better than going to Turkey and just getting a random 2,000 graft, $2,000 hair transplant? Probably, because it's a known entity. There's a track record. There's a skill set. There's consistency. There's training that's legitimate. Um, Most $2,000 hair transplants in Turkey will wind up costing a hell of a lot more to get them fixed, if it's even possible. So, like I've always said, that cheap hair transplant might wind up being the most expensive hair transplant you never wanted because of all the repair. And in many cases, you can't fully repair them. So, thanks for the question. Let's see. One. Hey, Joe, can scalp issues such as dermatitis and general scalp inflammation, itching worsen the hair loss? They are on finasteride. Yes, absolutely. Need to get that stuff, need to get that settled because inflammation can cause or uh, exacerbate hair loss. Absolutely. If for any reason, because you're scratching it, and that in of itself can knock the hairs out. Kendall, thanks. I've heard of Barton. Dad scheduled with Dr. Yeah, Michael Hughes, and yeah, so he's in the Beverly Hills office. He was the first fellowship trained doctor out of Alvia Armani under Dr. Bobak, and he's really good. They're the two doctors I work with are really really top shelf. There's a third one there. She's up and coming. She's still doing her fellowship under Dr. Hughes. She did train. I think she trained some with Dr. Bobak. I could be wrong. And look at that. I haven't looked at her very closely, but she's up and coming. I mean, she's apparently doing a really good job for them, or so I'm told. So maybe we'll be seeing more of her in the future. But Dr. Hughes he's top shelf. Let's see. Who else? David Spandy, one of your guests say the max transplant density on otherwise bald scalp was 50% of normal hair. Have you found this to be true, or are there any cases you have seen greater than 50% density? I've seen a lot of cases like that, and I don't remember who you're talking about, but um, you can go more than 50% density in one surgery. I don't recommend it. And you can certainly get above 50% with 2 or even 3 surgeries. But is it necessary? And that's why, or one of the reasons why I like doing smaller procedures up front as opposed to bigger ones, because it may be enough. Who knows? Like if you go to a surgeon that's promising you 80 grafts per square centimeter, um, good luck. I hope it works out for you. And I've seen outcomes like that where it grew fine, it looked fantastic, nice and dense. But what if 50% was enough? You know, that's wasted donor hair. Like my hair, you know, this is 55. And that was not actually, it wasn't one surgery in the very front, because that was from the surgery in 2010. That was the last hairline surgery I had with Dr. Wong. God, that was 15 years ago. Holy shit. And it was just hairline. Like he lowered it a little bit. So all this right here was one surgery, and that was 55. And I have no need to go thicker than that. I really like my hairline. Wouldn't mind it being a little bit lower, but for anything better. So going much higher will be a waste. Where some hair could be or was used in the back, but um, if it was placed in the front, I'd have less to put in the back. And my back, I mean, I'll show you the back right now. I think it looks okay. Pretty happy with that. Let's see. Thanks for the question, David. One, how intense does stress need to be in order to worsen hair loss? For example, is daily work stress enough to worsen loss, or does it need to be very intense? That's very subjective. Cortisol levels and the way that we produce them, it's a physiological issue that is variable from one human to the next. I can't answer that question. Good question though, but I can't answer that. Thank you on call. Thank you very much. Okay, anyone else? Nope. I'm probably going to have to go here in just a second. Kendall Hughes, 55 per square centimeter on you looks amazing. Thank you. Nice variation and very natural look. Must have used a good number of single. Yep. Can't even tell. Thank you. That's very kind of you. Yeah, I mean that's the point of using microscopes. That's one of the non-negotiables with clinics I work with. And I did that video about Kyle Christie and his hairline, and all these other hairlines that I showed from bad clinics throughout the world. Yes, including Turkey, but some in the UK and other places. And the one constant has to be stereoscopic dissecting microscopes, because if you have them and then you know how to use them, because just having them isn't enough. You have to understand how to use them. It does add a level of complexity to surgery that people don't realize. When I made that video, I actually had doctors contacting me saying that they had no. It's funny. I had some doctors contact me saying they had no idea that it made that much of a difference, and I had other doctors contact me saying they had no idea doctors weren't using them. Like they had no idea that there were doctors not up to speed on using flicker unit, stereoscopic dissecting microscopes to refine and create single hair grafts where necessary. So it's it's interesting, but yeah, thank you for that. Let's see, Mike Pedroza, what's up, Joe? Hey, buddy. I am at the airport, headed to the UK here in just a bit. Actually, I probably need to go here in a minute. Had a little bit of dinner or a snack, had a beer, and I thought I'd fire up the old YouTubers and talk to you guys. Yep. Okay. All right, guys. I think I'm going to shut it down for now. If I have a good connection on the flight, maybe we'll fire it up. We'll see. But in the meantime, thanks guys for tuning in and helping me to pass the time. And I will be live streaming. Sorry. Yeah, just a bill. Thank you. I will be live streaming at least twice this coming week. So be sure to like this video. Let's trigger the algorithm, guys. Come on, appreciate it. And if you haven't subscribed, you just found me. Subscribe because I'm going to be interviewing two different doctors, at least two, maybe more. And I will be talking maybe to a couple of patients. Um, don't know if that'll be live, but maybe I don't know. We'll see. These things are unpredictable. I try to plan, but it never works out exactly the way I want it. Sometimes it's better, sometimes not quite so great. But there will be some live streams. So I do hope that you tune in. And thanks a lot for tuning in on this one. You guys take care. Good night.